Hi friends, I'm April, and if you're watching this, there's a good chance you're prepping for the NCLEX. So welcome and congratulations on joining the profession. You just have one final hurdle to pass. If you're trying to memorize every single lab for the NCLEX, please stop. You don't need to know all of them. You need to know the right ones, the ones that show up on the test and actually matter in practice. I'll show you the top 10 high-yield lab values for the NCLEX in 2026, plus easy memory tricks that'll help them finally stick. From potassium to platelets, I'm going to help you declutter your brain, ditch the overwhelm, and pass smarter, not harder. And stay until the end because I'm going to show you a simple grouping trick that will help remembering all of that 10 times easier. Please like, share, and subscribe. Before we jump into the numbers, let's get something straight. They pick labs the way they do based on these factors. What can kill your patient? What requires immediate intervention? What nurses recognize first? So today we're focusing on labs that show up repeatedly, affect the cardiac rhythm, bleeding, oxygenation, and infection, or require rapid or immediate nursing action. If you master these 10, you're 80% covered. Let's start with the big one. Number 1, potassium. Normal is 3.5 to 5. This is the queen of NCLEX labs. Why? Because potassium equals heart arrhythmias. Too low, also deadly arrhythmias. Memory trick, 3 to 5 keeps the heart alive. 3.5 to 5. Below 3.5, think muscle weakness plus U waves. Above 5, think peak T waves and cardiac arrest. Especially think of this if you've got a renal failure patient. If you only memorize one lab perfectly, please, please, please make it potassium. Number 2, sodium. Normal, 135 to 145. Think brain. Low sodium, got brain swelling, confusion, and seizures. High sodium, brain shrinking, and neuro symptoms. Memory trick. Sodium runs 135 to 145, so mid 130s to mid 140s. It's a nice clean range. It affects the brain. NCLEX loves it. Calcium. Normal is 8.5 to 10.5. Calcium, it's important to the muscles, bones, and heart. Your memory trick is think of a 10-point scale being for strong bones, 8.5 to 10.5. When you're thinking low calcium, think tetany, Chvostek sign, Trousseau sign. And when you're thinking high calcium, think kidney stones, constipation, and again, confusion. NCLEX loves hypocalcemic signs. Number 4, magnesium. Normal, 1.5 to 2.5. Magnesium follows calcium. If you got low magnesium, you're looking at seizures and arrhythmias, specifically, possibly torsades de pointes, a fancy French name. You see this frequently in alcoholics. High magnesium, lethargy, respiratory depression. Memory trick, magnesium is mini compared to calcium. 1.5 to 2.5, small numbers. And remember, magnesium stabilizes the heart and nerves. Number 5, glucose. Your normal fasting is 70 to 100. This is everywhere. Below 70, think tired. You may see tachycardia, irritability, restlessness, excessive hunger, diaphoresis. Now, you're looking at an over 100 fasting glucose. You're looking at hyperglycemia risks. Again, NCLEX loves hypoglycemic emergencies. Memory trick, under 70 equals low. That's the key number. Number 6, moving on to hemoglobin. For men, the normal range is 14 to 18. For women, it's 12 to 16. If you don't want to remember both, our brains are pretty full at this point, just remember hemoglobin under 12. Think anemia. Hemoglobin carries oxygen. So if it's low, think fatigue, pallor, shortness of breath. NCLEX will give you a bleeding pattern. You need to recognize when it's dangerous. Platelets, normal being 150,000 to 140,000. Think clotting. Your memory trick, platelets are in the hundreds. 150 to 400. Below 100, you've got a bleeding risk. Under 50, you've got a serious bleeding risk. Under 20, you've got a risk of spontaneous bleeding, and you'd better be sure that that patient is very well protected. Number 8, WB, your normal range is between 5,000 and 10,000. This is where we're looking at potentials for infection. Over 10, we're thinking infection or inflammation. Under 4, if you don't know you have an immunocompromised patient, it's definitely time to start thinking you might. Your memory trick is 5 to 10 keeps infection in check. Simple, clean. Moving on to number 9, creatinine. Normal is 0.6 to 1.3. It's your kidney function marker. Also seen with a BUN above 1.3, know your kidneys are struggling. They may be struggling because of medications or dehydration, but it's absolutely key to know it if they're going to have any radiological studies of any kind, because we give contrast and that can affect our ability to give it. Your memory trick is creatinine stays around 1. If it climbs, the kidneys decline. Number 10, our last one, INR. Normal is 0.8 to 1.2. If they're on warfarin or Coumadin, it's 2 to 3. NCLEX loves anticoagulation safety, so definitely be looking at that in any of your scenarios. If you've got a high INR, you've got a bleeding risk. Memory trick, INR of 1, normal. INR of 2.3, anticoagulated. If it's 5, you're in the danger zone. Now, here's the trick that makes all of this easy. Let's try grouping the labs by what they affect. Heart rhythm, we've got potassium, calcium, and magnesium. Brain, we've got sodium, glucose, and bleeding. You've got platelets, INR, and hemoglobin. Infection, we've got WB, and rounding it out with kidneys, we've got creatinine. Now, we don't just have 10 random numbers we're trying to remember. We have 5 categories, and our brains love patterns. NCLEX rewards patterns. So you don't need to memorize 50 labs. You need to master the ones that save lives. Focus on electrolytes, bleeding risk, infection, oxygenation, kidneys. That's how you pass smarter. If this helped you, comment labs below and let me know which one you struggle with the most. I might take a deep dive on that one next. If you'd like a quick little study guide for you to use to cram right before you go in to take the NCLEX, I put a link in the description. All you have to do is click on it and you'll have it. You can print it off ready to go. If you're studying the NCLEX right now, please know you've got this. And all of us already in the profession are rooting for you and are ready for you to come out and give the kind of great care we know you can. Pass smarter, not harder. Please like and subscribe. I can't wait to see you out in practice. And thank you for being with me today. See you soon.